make the tissue and go it delayed. So these are the two options. Any more questions?
What about width? For example, any case, we have a buccal diameter 10 millimeter.
Yeah. Very good question. It's called as a 1/2 rule. I saw it. I forgot it. So there is something called as a 1/2 rule. So whatever the tooth you have, so if it's a molar, so say 1/6. Okay. So 1/6 upper will have a diameter of 12. So when you want to select it, just half it. So that will be the diameter of an implant approximately, because it will have a larger load. Okay. So if you use it narrow, what will happen is it will again get like you. Can you give me 15 more minutes? I have another presentation for this. But anyways, okay. The problem is when, like, I'll give you a gist. When you use a narrow implant on a high stress area, what happens is, now this is a narrow implant, and then this is a very big crown on it. So what will happen is, it already has a cantilever. So this cantilever will create shear forces coupled. So this is also very detrimental, and that's why when you're using narrow implants in grade 4 titanium, usually you either have fracture of the implant or screw loosening or bone resorption. So this is just like some complication that will come, but it will always happen. Like you already know what you
Better to reduce the buccal diameter of the.
Even if you reduce the buccolingual, but the mesodistal is because you have to actually close the like interdental spaces. So even if you try to, like, instead of using this occlusal tape, you premolarize the molar. That is the term. You actually use the crown of the molar should look like a premolar. So it's premolarizing the molar. But you cannot reduce the mesodistal. Mesodistal is the same. You have to cover this space. Any more questions? Yes.
Sir, you mentioned about tissue thickening after ortho treatment. I have a doubt, sir. I'm limited by my experience as a third-year undergraduate student. So, you mentioned that it is due to the bone formation, so the tissue is getting thickened.
Bone formation as well as stress behavior.
Yes.
So whenever you have thicker tissues,
Yes.
and when you try to pressurize thicker tissues, it will actually, instead of resorption, it will start falling. Whereas where you have thin tissues, like when you're doing, like if you're an ortho, right?
I'm an undergraduate third-year.
Third year, you will know. Like, but again, I'll actually reverse this example. When ortho is doing a case in lower anterior, and when they start doing bodily movement, and when they are actually pushing the buccal plate, the tissue starts receding. And then, if you are really unlucky, you will have at least one incisor which will not have anything. It will be like completely without the tissue. And this complication is like a havoc to like even if you do 50 different surgeries, connective tissue, pre-gingival graft, it will not stay. Because there is no bone. Imagine your clothes, it's the tissue, and your body is the bone. If there is no bone, there will be no, the tissues will never be stable.
Primarily we do talking initially for canines which are more outward.
Usually, you know what, because this complication, if you do it abroad, and if this happens, there is a good compensation. The patient can sue you. So what the doctors started doing is, they actually first, if they encounter such cases, they first remove the flap, they actually do decortication and grafting, then they suture it, and then they start the tooth movement. So that even if there is compensation, the graft will be always there to support the tissues. I hope you guys liked it. I was not boring.